I'm Helen Bristow. I'm editor of The Pathologist, and I'm joined today by Michele Mitchell, a patient champion with the American Society for Clinical Pathology, a patient advocate volunteer, and a patient advocate for the Digital Pathology Association. And I'm also joined from Karachi in Pakistan by Dr. Sharjeel Chaudhry, a consultant pathologist at Dow University Hospital. And we're going to be discussing bridging the knowledge gap between clinical setting and patient setting in molecular pathology. So if I can start with you, Sharjeel.
Yeah.
Molecular pathology can be quite a confusing specialty, both for people in the clinical world and patients. But if we think about patients, what would you like oncology patients to understand about the value of molecular pathology?
So one thing I really wish oncology patients understood is that molecular testing isn't just about finding a targeted therapy. So that's obviously important, but it's only one part of the picture. Often, molecular pathology helps us understand the biology of the disease, why a cancer behaves aggressively, why it responds or doesn't respond to treatment, and what kind of therapies are unlikely to help. Even why, when the results doesn't immediately change the treatment, it still has a value. It can prevent unnecessary toxicity, support standard of care decisions, and create a molecular baseline that helps and becomes useful later as a disease evolves or new therapy emerge.
And Michele, from the patient perspective, what would have helped you better understand the value of molecular testing, even when it didn't immediately change treatment?
Well, what would have helped me most was understanding that molecular testing isn't just about finding a drug today. It's about learning the biology of my cancer for tomorrow. Early on, results were presented as simple yes/no answers. When the report said nothing actionable, it felt like a door was closing instead of information that still had value. You and I talked prior about precision medicine in terms of that many patients hear perhaps, but rarely understand. Even as an engaged advocate in molecular pathology, I often felt invisible, something happening behind the curtains rather than part of my own lived experience. I recently read an article in the AARP magazine was called A Fighting Chance, and the author described how he had pushed for whole genome sequencing of his father's illness and a little known test called I believe it's called an Aranoid test. And this gave his father a real chance at living a couple of years longer because it provided some of those answers. Dr. Chaudhry and I are aligned in believing that advocacy at the intersection of molecular pathology and patient understanding is an unexplored but critical space. And we hope through this video series that we can attempt to make that connection visible.
Thank you for that perspective, Michele. So, Sharjeel, reflecting on that situation when a biomarker result doesn't lead to targeted therapy, how do you think pathologists can help frame that outcome as still clinically meaningful?
So, in terms of molecular pathology, so the thing is that biomarkers are really important. So, if we can't find a biomarker, there are many ways to find what type of cancer we are getting or what type of treatment a patient requires. So, there are various kinds of diseases, including cancers, genetic diseases, that aren't identified that aren't diagnosed by certain biomarkers, certain tests, and they are in our terms, it's called idiopathic diseases that do not have any clinical symptoms nor um, any early stage anything to diagnose. So in terms of that, molecular pathology, NGS plays a great role.
Yes, and so NGS in itself it can be something that's very hard to understand
Exactly.
for patients. So let's look at that communication now, because oncology is becoming such a complex diagnostic setting. So Michele, what information was shared on your first encounter with molecular oncology, and what questions were left unanswered?
Well, my first encounter was almost entirely transactional, blood drawn, tissue sent, report returned. I was told the testing was being done to, quote, look for mutations, but no one explained what that meant. Could it influence treatment later? Could it help my family understand risk? Could it contribute to research? I was left with so many questions. Who actually interprets the results? Why do two patients with the same cancer get different test results? If nothing is actionable today, could it matter later? I've taken part in many podcasts and webinars and panel discussions, but really, it was only when I spoke with Dr. Chaudhry about how little patients understand the value of molecular pathology and what it meant for targeted treatments that really came to light. Every day, from CRISPR to immunotherapies, the landscape is changing, yet many patients don't know what these advances mean for them. Patients don't need a lecture in genomics. We need to have that bridge from labs to our lives.
Yeah, so Sharjeel, biomarkers, genomics, next generation sequencing, these are quite complex concepts, even in the medical world. How can pathologists help patients understand these things?
So biomarkers, genomics, transcriptomics, these are like very harsh and very technical and overwhelming words towards the patients also. As for the pathologists also, like most of the pathologists, they also don't know the difference between these omics. So, as a pathologist, our role shouldn't stop at producing technical perfect reports. We also have responsibility to help translate and complexity into language that clinicians and ultimately patients can understand. So, in this, pathology clinics plays a vital role. So, if a molecular pathologist is dealing with a patient directly and explaining everything to them directly, it would change something in that aspect.
Yes, that sounds like a great way forward. And of course, aside from the technical aspects of molecular pathology, patients can sometimes be confused that it doesn't necessarily give them a yes or no answer when they have a biomarker test. So how do you think about explaining probabilistic or evolving results when patients often want certainty?
So, the thing with molecular pathology reports are not just it's to diagnose the biomarker, it's for the therapy. So, like molecular pathology is a bridge between the therapy and the result. So it's about the part that molecular pathology plays, that if a certain biomarker is involved in a cancer, so it is not that we can remove that part to remove the biomarker, or to we can give some medication to like downregulate that. The main part play when we we help to create that drug that ultimately downregulate that biomarker to help treat the patient more effectively. So as you know that there are more than 10 types of breast cancer. The one involves the biomarker BRCA1, BRCA2, HER2. So we can't just give same medication or therapy to every individual that has breast cancer. There are certain therapies for the individual with BRCA1 mutation. There are certain therapies for BRCA2. Um, HER2, we have separate drugs for the therapy. So to know that, we have to also know the difference between biomarker and how we can produce certain drugs to ultimately overcome the disease.
Yes, that sort of information should certainly be provided to patients. But Michele, thinking about your contact with your test results, how do terms like no actionable mutation or variant of uncertain significance, for example, land emotionally for patients?
Well, those phrases can feel devastating. I mean, no actionable mutation sounds like nothing can be done. And variant of uncertain significance feels like science doesn't know what to do with you. Without context, these words can unintentionally create hopelessness. What helped me later was learning that a result can still be meaningful, even if not immediately actionable. Knowledge can guide future trials or family decisions, and science evolves. Today's uncertainty may be tomorrow's answer. I often turn to tools like ChatGPT to translate my reports because health systems don't. I believe institutions must do more, and AI could become a powerful partner in turning pathology language into patient language.
Yes, thank you for giving that perspective. So now let's look at some of the myths that arise around biomarker testing. Sharjeel, what are the biggest misconceptions that patients have about, let's take the example of liquid biopsies, for example. What are the
So
biggest
liquid
misconceptions?
biopsies are often seen as simpler or more complete because they are less invasive. So it's a like less invasive tool for the diagnosing certain disease or cancer. Patients sometimes assume they replace tissue biopsies or give in all the answers. In reality, they are powerful tool, but they have limitations. A negative result doesn't always mean the absence of disease mutation. It may reflect biology, timing, or tumor burden. Explaining those limits is just as important as explaining the benefits. And that an area where clever communication can really help patients.
Yes, and Michele, and as a patient, I'm sure you've had your fair share of myths and misconceptions yourself. What role do you think pathologists could play in dispelling those sort of misunderstandings in precision medicine?
Well, pathologists are the most important clinicians most patients have never met. Misconceptions, especially about liquid biopsy or even AI, grow in that silence. And patients imagine tests are either magical or meaningless. You know, a short, plain language explanation attached to a report could transform trust. What the tests can and cannot tell, why tissue still matters, and how results guide but don't dictate decisions. I'm committed to partnering with laboratory professionals to break down common tests into simple human terms and to share that understanding with patients through this article, video series, in whatever format is necessary.
Yes, so that's a good example of what pathologists could do differently in order to help patients. Is that what would be your advice to pathologists listening to this in terms of what they could do differently tomorrow?
Well, first off, remember that behind every specimen is a person refreshing their portal at 2 a.m. I would ask pathologists to add just one sentence of meaning to every report. Use language that explains uncertainty without taking away hope, and see themselves as part of the patient story, not just the diagnosis, because your expertise changes lives, even when we never know your name.
Thank you, Michelle. And Sharjeel, what do you wish patients understood about the role of pathologists in precision medicine?
So pathologists are deeply involved in patient care, even if the patient never meet us face to face. Nearly every precision medicine decision depends on pathology. So especially molecular pathology working accurately behind the scenes. Molecular pathology plays a backbone in precision medicine therapies. If the patient better understand why we test, not just what we test, I think they feel more supported and more trusting of the process, even when the answers aren't immediate or straightforward.
So following on from that, Sharjeel, what do you think needs to change in order to advance the role of pathology in precision medicine?
So, pathology is itself playing a great role in precision medicine. So, like, in terms of every kind of pathologist, so we have molecular pathologists, we have anatomical pathologists, we have every kind of pathologist. Pathologist identifies the biomarker or the certain checkpoints where is the start of the disease. So precision medicine is like a targeted therapy for that disease, for that patient, for that cancer, for that condition, that if that particular point is eliminated, the disease itself would be like ended. So pathology itself is playing a very great role in precision medicine.
Michelle, Sharjeel, thank you very much for sharing your insights today.
Pleasure is all mine.
Thank you, Helen, for bringing this important topic to all of us, and thank you for the opportunity.